Coronavirus coverage now. Local health providers are saying some people are eligible to get out and get their third vaccine shot today. But who should get a COVID booster shot and why?
Katrina Lim spoke with a local woman who explains why she already went and got her extra dose.
The first polio vaccine that we got, I was 8 years old, and they put the dosage, the actual medication, on a sugar cube, and we got it that way.
75-year-old Marlene Strum of Lake Hallie remembers when she first got her polio vaccine, and she recently received a booster shot to help prevent COVID-19.
And I just called in, and I went in and got my booster, and it was very simple, easy kind of thing.
Strum says part of the reason she wanted to get a booster shot is because she has congestive heart failure, an autoimmune disease, and due to her experience with polio.
I do know of kids who got polio and were in the iron lung, and some didn't make it. After the fact, the residual, one of them had a very difficult time walking. For me, that made a big difference.
Her other reason, to help others.
A booster helps me first because I don't want the COVID, thank you. And the secondary thing, I certainly don't want to give it to you or to these kids I see coming in, the stores that I go into.
The Wisconsin DHS and the Eau Claire City County Health Department say certain groups should go ahead and get the extra shot.
Those people that are over the age of 65, those individuals that live in a long-term care facility, so again, maybe people that are also over 65, but maybe younger people, but those in those congregate living situations. And then those individuals that are 50 to 64-year-olds who have an underlying health condition.
DHS recommends people who are 18 to 49 may get a booster shot if they have certain underlying conditions, and those 18 to 64 may get one if they are at increased risk of exposure because of their job.
That was Katrina Lim reporting. News 18 also reached out to HSHS, Marshfield, and Mayo, and all three say they have ample supply to meet the expected demand for these third doses. And they're also experiencing a large number of calls at this time, so they ask everyone to schedule their appointments online if possible. Appointments are required for Prevea and HSHS.